No.
Hear me now? I'm going to log off, then log back in. I'm at work and I'm on my computer attached to that. Let me log off, back on again. you guys hear me now?
Yes.
Oh, wonderful. Thank you. Can you see the questions on my screen?
Yes.
Oh, good. I did that right. Okay. All right. So we'll go ahead and get started. I do want to let you guys know that you're being recorded. Um, so got that going. Got our first question. Select all that apply. The nurses in the emergency department monitoring a client who has a cervical injury from a fall. The nurse should monitor the client for which of the following complications? So we're thinking about a client who has a spinal cord injury, and we think about where. It's a cervical injury, so it's pretty high up. So what do you think would be complications? What about hypotension? Did you talk about spinal cord injuries and levels of injuries, those kind of things?
Yes, we did talk about it.
Oh, okay, okay. So what do you think, looking at these answers, what do you think that the answer would be? Anybody got any guesses?
Good grief. Depending on where it's at, is you said it's high up.
It's in the cervical, so it's in like the neck, the cervical region.
Okay,
A,
hypotension.
D, and E.
Yeah, who said that?
Kelly.
Ellie. So why do you think that? Tell me why.
Kelly. It's Kelly.
Hi, Kelly. Tell me why it was A, D, and E.
I think because the higher up this injury, the risk respiratory distress. So I think I don't know. I thought of hypotension and definitely gonna have absent bowel sounds and decreased gag reflex.
Right. So the other ones, what I kind of think about is when there's a spinal cord injury, that information that's getting to the body and back to the brain is interrupted. So the things that should happen, there is either a delay in that or an absence of that. So in lieu of polyuria, we would actually see urinary retention and look for bladder distension. And instead of hyperthermia, it'd be hypo. So the temperature's low, the blood pressure's low, bowel sounds are low or absent, uh, weak reflexes like gag reflexes. So the other two of those, polyuria and hyperthermia, are elevated. Things are working overtime. Yeah, it was A, D, and E. So number two, a nurse is admitting a client who has active TB med-surg unit. Which of the following room assignments should the nurse make for the client?
A.
Ah, so a room with air exhaust directly to the outdoor environment. That's perfect. What happens with the negative pressure room that we put those patients in is that the air, instead of being blown out into and circulated through the rest of the hospital, it's actually um, circulated out of the facility. And so, one thing you can do with those negative pressure rooms is, and we used to do this, is you could either get a tissue or a piece of paper, and if you put it at the bottom of the door, um, rooms usually their airflow will push the paper out, but in these rooms it kind of sucks the air in. because it's being drawn into the room and then put at the outside of the facility. So those rooms also have an ante-room. Sometimes the NCLEX questions will ask you about like an ante-room that you go in to put on PPE before you enter the room. So yeah, we never want to put them with another patient. A room in an ICU isn't quite specific enough. I mean, there can be negative pressure rooms in an ICU. We would have those, but not every room would be. And then a room that's within the view of the nurse's station, that's not necessarily something we need with patients. All right. 3, a nurse is caring for a client who has a new diagnosis of urolithiasis. Which of the following should the nurse identify as an associated risk factor? So what is urolithiasis?
Is it kidney stones?
It's a urinary stone. Yes. So if we had nephrolithiasis, it'd be a kidney stone, but urolithiasis is a stone, but it could be anywhere in the urinary system. So it could be in the kidneys, the ureters, the bladder, the urethra, any of those areas. And sometimes this kind of refers to something that's caught in the ureters. So with that, with patients that have any kind of urinary stone, which of the following should the nurse identify as a risk factor? No? This one is actually a family history. So family history is strongly correlated with the formation of stones. Some of them are calcium associated, some of them are oxalate stones, different types of things, but really it's the body's, the way it metabolizes materials and also produces things that break down stones. So there is a family history that goes along with production of urinary stone. Nurse is receiving the arterial blood gas values of a client who has chronic kidney disease. Which of the following sets of values should the nurse expect? So I think about kidney disease, what the kidneys do. Kidney disease being renal failure. When we think about the kidneys, what is their part in acid-base balance?
They remove the waste product. They're supposed to filter it out. So it would be metabolic acidosis, I believe.
Yes. So the kidneys produce bicarbonate to, as well as filtering out waste product. And so if we have kidney disease, we're not producing a lot of bicarbonate. In fact, it's low. So, and it's not a respiratory problem, it's a metabolic problem. So with low bicarbonate production, we have a metabolic acidosis. One of those do you think would be a metabolic acidosis? So pH is 7.35 to 7.45. Should acidosis be higher or lower than that?
Lower.
Okay. So lower would kind of rule out the bottom two. So if we look at pH, we can rule out the bottom two. So then we move on to bicarbonate, and we said bicarbonate is 22 to 26. So we said the kidneys, if they're in renal failure, aren't making enough bicarbonate. We can rule out another one. So what are we left with? We looked at B, bicarbonate 22 to 26. The bicarbonate in B would be normal, so that wouldn't be a problem. The problem there would be a respiratory problem. So we can move on to A and say that pH is low, that's acidosis. Bicarbonate is low. So that would be in the same range as pH. And PaCO2 should be 35 to 45. And that's actually low, moving in the opposite direction. So we actually have a metabolic acidosis with some partial compensation there. So whenever I look at a question like this, I look at the problem and what I would expect from that problem. And in this case, it would be kind of what is the kidneys responsible for with acid-base balance. And then once I can identify that, I look at the answers and I determine the pH. And then I move on to look at the bicarbonate and the CO2. We have another select all that apply. A nurse is assessing a client who has fluid overload. Which of the following findings should the nurse expect? I'll let you look at this one and you let me know what you think.
I don't see your screen anymore.
Oh, okay. Let's see. Is it back?
Yes.
Okay.
Yep.
Okay. Good. Nurse is assessing a client who has fluid overload. Which of the following findings should the nurse expect? So would we expect an increased heart rate with fluid overload?
Yes, and
Okay.
increased blood pressure.
Good. What about respiratory rate?
Yes.
Yes. What about hematocrit and temperature?
I don't think so.
Yeah, those are kind of some odd ones thrown in there. We would actually, if we were going to look at the blood work and had fluid overload, we would expect a decrease in the hematocrit because we're looking at it in comparison to the amount of fluid. So if we were dehydrated and we drew a sample of blood, we would probably see an increase in hematocrit because we would have less fluid compared to the blood cells. And then similarly, if we were dehydrated, our temperature may be elevated as well because our body's working really, really hard to kind of blow off some of that heat. So with fluid overload, we would see A, B, and C. Good. Nurse is completing discharge teaching with a client following arthroscopic knee surgery. Which of the following instructions should the nurse include in the teaching?
Can you apply ice to the knee?
Yes. So we wouldn't want them on bed rest. We want them up moving around. And remember, arthroscopic knee surgery is kind of where they're going in with a scope. They're making a tiny incision and going in and looking around and doing surgery. So we want them up moving around. We wouldn't want to keep their leg in a dependent position because we think after surgery we want to decrease edema. And then beginning active range of motion, many times after surgery, the first thing is going to be some passive range of motion. So, but we definitely would want to decrease edema so we could put ice on the affected area. Nurse is caring for a client who has emphysema. Which of the following findings should the nurse expect to assess in this client? When I think about emphysema, I know it's a chronic disorder. So I'm going to see problems that
Dyspnea, barrel chest, clubbing of the fingers.
yes. So we have dyspnea, we have shortness of breath. We will actually may see some tachycardia because we're working so hard. Barrel chest and club fingers, we're going to see as evidence of a chronic respiratory problem. And then we may see fast respirations, but we're not going to see deep respirations because they're not able to take those big, deep breaths. So it would be A, C, and D. Nurse is assessing a client who sustained a basal skull fracture and notes a thin stream of clear drainage coming from the client's right nostril. Which of the following actions should the nurse take first?
A.
A.
Drainage.
Yes, we're going to test the drainage for glucose. And so even on some of these questions, if you are reading it and you're thinking, oh, I don't know about some of this, you're going to run into some of the classic things that are really indicative of those body systems. So thinking about reading that, we're thinking about cerebral spinal fluid, right? So we might not have talked about it in relationship to a basal skull fracture, but knowing that that's concerning and what we do about it. A nurse is caring for a client who's receiving TPN via a peripherally inserted central catheter. When assessing the client, the nurse notes swelling in the client's arm above the PICC insertion site. Which of the following action should the nurse take first?
Would you apply a cold pack or notify the provider?
What I think about when I look at this question, when I look at each of those answers, I always reflect back on the nursing process. And if I read that question and I say, I don't know, that means I need more information. So I'm going to go back and do an assessment. And part of that assessment would be doing something that gives me more information. So the correct answer is actually measure the circumference of both upper arms. So we could tell if there was any edema that had increased in that, if the arm is swollen, and then if there truly is edema, then we could notify the provider. So they have to do an assessment, further that assessment. A nurse is assessing a client who is 48 hours post-op following abdominal surgery. Which of the following findings should the nurse report to the provider?
C.
Yeah, that doesn't sound good at all. Yellow-green drainage on the surgical site. Yeah, definitely. So normal from abnormal. The nurse is monitoring a client who was admitted with a severe burn injury and is receiving IV fluid resuscitation therapy. The nurse should identify a decrease in which of the following findings as an indication of adequate fluid replacement. That's one of those questions that I would read and then go, I'm going to go back and read that again. That was a long one. So if we go from a state of being dehydrated to being hydrated, which one of those things should decrease?
B, the heart rate.
The heart rate, right. Nurse is caring for a client who has Cushing's syndrome. The nurse should recognize that which of the following are manifestations of Cushing's syndrome?
Moon face and buffalo hump.
And purple striations.
Yes. I'm reading kind of their rationale on here, and they have the moon phase, purple striations, buffalo hump, but they also have alopecia. And it says clients who have Cushing syndrome can develop hirsutism, which is excessive body hair, but women can also develop alopecia. So that was, but they wouldn't have tremors. The kind of the classics there would be the moon face, the purple striations, and the buffalo hump. Now you know they could get alopecia. The nurse is caring for a client who has Parkinson's disease and is taking diphenhydramine, 25 milligrams POTID. Which of the following therapeutic outcomes should the nurse expect to see?
Decreased tremors.
Decreased tremors, yes. So again, thinking about Parkinson's, thinking about what some of those symptoms are. Nurse is caring for a client who had chemotherapy-induced peripheral neuropathy. The nurse should expect the client to report having experienced which of the following symptoms?
B.
B, tingling feelings in the extremities. So any kind of neuropathy, peripheral neuropathy, thinking about the hands and the feet, lack of the nerve stimulation, so numbness and tingling are the things that we look for. Nurse is assessing a client who is admitted with hyperthyroidism. The client reports a weight loss of 5.4 kilograms in the last 2 months, increased appetite, increased perspiration, fatigue, menstrual irregularity, and restlessness. Which of the following actions should the nurse take to prevent a thyroid crisis?
Provide a quiet, low stimulus environment.
Yes, quiet, low stimulus environment. We want to be able to slow everything down. Nurse is assessing a client who's receiving 1 unit of packed red blood cells to treat intraoperative blood loss. Client reports chills and back pain. The client's blood pressure is 80/64. Which of the following actions should the nurse take first?
Stop the infusion.
Stop the infusion. Yes, they'll ask that question many different ways. Yes. Nurse is reviewing laboratory values for a client who has systemic lupus erythematous. Which of the following values should give the nurse the best indication of the client's renal function?
A.
A, serum creatinine. BUN is giving us the nitrogen waste product that could be from many different things in the body. Creatinine is the most specific related to the renal system. Nurse is caring for a client who's admitted with bleeding esophageal varices and has an esophagogastric balloon tamponade with a Sangston-Blakemore tube to control the bleeding. Which of the following actions should the nurse take?
Let's see.
Yes. So anytime you have a question about an NG tube or in this case, the tube for esophageal varices, anybody that's ventilated, anybody that's not taking PO because they have a tube. Frequent oral care, Nares care, very important to prevent infection that can go into the nose or mouth and go down into the lungs. Nurse is planning care for a client who has end-stage cirrhosis of the liver with encephalopathy. Which of the following interventions should the nurse plan to implement to decrease the client's ammonia level?
C.
Yeah, reduce the client's intake of protein. Those byproducts of protein are what create that ammonia. Nurse is caring for a client who has been admitted for an acute exacerbation of ulcerative colitis. Which of the following actions should the nurse take first?
Review electrolyte values.
Yeah, review electrolyte values. When we think about ulcerative colitis, characteristic are things like bleeding and diarrhea. So we think about fluid imbalances, and that has to do with electrolytes. Nurse is caring for a client who is 5 hours post-operative following a transurethral resection of the prostate. The nurse notes that the client's indwelling urinary catheter has not drained in the past hour. Which of the following actions should the nurse take?
Check for kinks.
Yes, check for kinks. So in this, I kind of think about using the simplest and the least invasive first. It kind of reminds me of the client that they're lying in bed and they're short of breath. What do you do first? And the answer is set them up. So we think about we're going to go to something really invasive, but sometimes it is the simplest thing that we check first. Nurse is in a client's room where the client begins having a tonic-clonic seizure. Which of the following actions should the nurse take first?
Turn their head.
Turn their head to the side. Why would we do that?
To prevent aspiration.
Yeah, prevent aspiration. This one's kind of like what's going to cause them the most harm? How can we prevent the most harm? Nurse in a clinic is reviewing the laboratory values of a client who has primary hypothyroidism. The nurse should anticipate an elevation of which of the following laboratory values?
A.
Yes, A, thyroid stimulating hormone. Anything primary is having to do with that organ, so there's a dysfunction in the thyroid. If it said secondary, it would be a problem with the pituitary gland. So primary, a problem with the thyroid, we would see elevation in thyroid stimulating hormone because it's working overtime saying, come on, thyroid, do something. Nurse is caring for a client who is post-operative and is at risk for developing DVT or VTE. The nurse should instruct the client to avoid which of the following unsafe actions?
Massaging her legs.
Yeah, we don't want to massage the legs. If there's a blood clot, it can detach and become a pulmonary embolism. Nurse is observing a closed chest drainage system of a client who's 24 hours post-thoracotomy. The nurse notes slow, steady bubbling in the suction control chamber. Which of the following actions should the nurse take?
D.
Yeah, D. So if we read the question, we would know that the slow, steady bubbling in the suction chamber is an expected finding. So we would just continue to monitor our patient. Nurse is caring for a client who has Addison's disease and is at risk for Addisonian crisis. Which of the following actions should the nurse take?
Weigh the client daily.
Weigh them daily. If we think about Addison's, it has to do with a patient who we're monitoring. Are they going into this Addisonian crisis? And one of the components of that is fluid loss. So we're going to weigh the client daily. We're not going to give steroids or things like that if they're not in a crisis. We're going to weigh them. Nurse is reviewing the laboratory findings for a client who developed fat embolism syndrome following a fracture. Which of the following laboratory findings should the nurse expect?
That's a tricky one. Increased platelet count.
It is a tricky one. And I'm sitting here reading the rationale on these, and I'm thinking these rationale are not very impressive. It's actually decreased serum calcium level. And I think we talked about this last time. It says a decreased serum calcium level is an expected finding, although the reason for this is unknown. And then it says increased lipid level is expected, but the reason is unknown. Increased ESR is expected, although the reason's unknown. And a decreased platelet, although the reason is unknown.
Yeah, that's real helpful.
Yeah, thanks for that. That's really going to be memorable. Right. A nurse is caring for a client following cataract surgery. Which of the following comments from the client should the nurse report to the client's provider? Which one would be concerning?
B.
Yeah, so increased pain, that sounds pretty intolerable. Yeah, definitely. The first one, there's a little bit of irritation, but she knows not to rub it. She knows that she's at risk of falls. She's also has some photosensitivity, that's expected, but the pain would be something we'd want to contact their provider about. Nurse is caring for an older adult client who has had surgery for an intestinal obstruction and has an NG tube to wall suction. Which of the following interventions should the nurse include in the client's post-op plan of care?
C, D, and E.
This one's kind of a tricky one. So it would be A. Anytime we're wanting to listen to bowel sounds, we would need to turn off the suction. B says irrigate the NG tube with normal saline. That would be okay, especially if there's anything like blood or things that are thicker in there, we might need to irrigate it. Place sequential compression device on bilateral lower extremities. We'd want to do that because the patient's had surgery. Anytime a patient has surgery, we're thinking about the possibility of increased risk of blood clots. So sequential hose would be normal. Reposition the client from side to side is normal. The reason they didn't pick E is because they said that we should encourage the use of a sinus spirometer every hour while awake, not every 2 hours. So some of those, looking at the details of those, but A through D would be correct. Nurse on a medical surgical unit is caring for 4 clients who are 24 to 36 hours post-op. Which of the following surgical procedures places the client at risk for a DVT?
B and C.
Well, in this one, it's just C.
And A. Duh.
Just C, yeah. So if we think about it, anytime we're looking at risk of a DVT, the highest risk is going to be someone who has had a joint surgery because they're manipulating the bone, the surgeries take longer, they have greater blood loss, all those types of things. So actually A and D would be more of an outpatient surgery. B is laparoscopic, so it's not as invasive. But the hip arthroplasty would definitely be our increased risk for DVT. Nurse is assessing a client who's in skeletal traction. Which of the following findings should the nurse identify as an indication of infection at the pin site?
Fever.
Fever, yes. The other ones would be unexpected finding. Nurse is reviewing the laboratory data for a client who has an acute pancreatitis. The nurse should expect to find an elevation of which of the following values? Although just one value, I don't know why it says values. Which value?
D.
Yeah, amylase. So amylase or lipase, always going to look at that for pancreatitis. skipped it. A nurse is caring for a client who is receiving a unit of packed red blood cells 15 minutes following the start of the transfusion. The nurse notes that the client is febrile, chills, red tinged urine. Which of the following transfusion reaction should the nurse expect?
Hemolytic.
Yeah, so with hemolytic, the person's own antibodies destroy the blood products. They destroy them, they break them down, and they're excreted by the kidneys. So we're going to see that red tinged urine. Good. Nurses in an emergency department is caring for a client who had a seizure, has become unresponsive after stating he had a sudden severe headache and vomiting. The client's vital signs are as follows: BP 190/10, pulse 82, respiration 24, temperature 100.8. Which of the following neurological disorders should the nurse suspect?
Is it A?
It is B. So when I look at that question, I think about that we've got severe headache and vomiting, and that makes me think of increased intracranial pressure. He said he had a horrible headache, blood pressure's elevated, heart rate is okay, respiration's increased temperature. If it was a TIA, then it would just be intermittent. So patient may have some slurred speech or things like that, and within 30 minutes it would go away. Thrombolytic wouldn't increase the intracranial pressure, it'd be more of a blood clot. But the hemorrhagic would be bleeding outside of the blood vessels in the brain and would give us that increased intracranial pressure. Nurse is caring for a client who is 1 day post-op following a transsphenoidal hypophysectomy. While assessing the client, the nurse notes a large area of clear drainage seeping from the nasal packing. Which of the following should be the nurse's initial action?
C.
Yeah, C. It's pretty similar to another question I put on there. Nurse is suctioning the endotracheal tube of a client who's on a ventilator. The client's heart rate increases from 86 to 110 and becomes irregular. Which of the following actions should the nurse take?
D.
D.
Yeah, so when we're going to suction somebody, we know that we're depriving them of some oxygen. And so anytime we're going to suction somebody, where they have a trach or where they have a ventilator, we want to pre-oxygenate them. So D. I don't know what happened here. Nurses admitting a client with suspected appendicitis. Identify where the nurse will palpate to assess for pain at McBurney's point. So where is our appendix?
Like right on the inside of your right hip bone?
Yeah, so right lower quadrant of the abdomen. McBurney's point is between the umbilicus and the right lower quadrant. So it's that mid area there, kind of making a straight line. And so that would be where that McBurney's point is. That's where we're going to have that rebound tenderness. I guess there was a little picture there. A nurse in the post-anesthesia care unit is caring for a client who's post-operative following a thoracotomy and lobectomy. Which of the following post-operative assessments should the nurse give highest priority to?
D.
It's actually A. So with this, we think about a thoracotomy. That's the thoracic cavity. So we're opening up the thoracic cavity. We are removing a lobe of the lungs. So we're going to assess for respiratory. And the best indicator of oxygenation, gas exchange is going to be our arterial blood gas. Nurse is assessing a client who has had staples removed from an abdominal wound postoperatively. The nurse notes separation of the wound edges with copious light brown serous drainage. Which of the following actions should the nurse perform first?
D, the culture and sensitivity.
Actually going to be C. When we think about the abdominal cavity, our worst consideration with any kind of a surgical incision is infection. And so if it is dehiscing, which is when the wound edges are separating, we're concerned about not only bacteria getting in, but of our intestines coming out. So anytime that happens, we want to lie the patient on their back to decrease the pressure and cover the wound with moist, sterile gauze dressings. We then call the doctor to come in and assess that. We wouldn't want the patient to get up so that incision would open up any further. Oh gosh, let's see. A nurse is assessing a client who's had femoral cardiac angiography. Identify where the nurse will palpate to assess the most distal pulse on the affected side. So if I had a heart cath or I had an angiography, they're going to go in and look at my cardiac, my blood vessels, and they're going to put dye in to my coronary arteries. They're inserting that in my left femoral artery. Where would I assess? Where would I palpate if I want to assess the most distal point?
The left foot.
Yeah, I didn't explain that very good, but yeah, I think that was supposed to be a little picture of a person there. So yeah, if we're going into the left femoral artery and we want to assess for perfusion, we're going to assess the left foot. Good. While assessing a client who is receiving continuous IV therapy via his left forearm, a nurse notes the site is red, swollen, and painful, and that the surrounding tissue is hard. Which of the following actions should the nurse take first?
A.
Yeah, we're going to discontinue the existing IV line. So it's already edematous, it's red, it's swollen, it's probably painful, and there's a hardened induration there. We're going to discontinue that. Nurse is caring for 4 hospitalized clients. Which of the following clients should the nurse identify as being at risk of fluid volume deficit?
Is it B?
I'm sorry, I didn't hear you.
Is it B?
It's actually going to be D. So our patient with gastroenteritis is going to have diarrhea, inflammation of the lining of the stomach. Having a fever can make you lose fluid as well. B and C are going to probably have fluid overload. If we have heart failure, BNP is elevated means we have heart failure, so we're holding on to fluid. Renal failure, and they're scheduled for dialysis, they're holding on to fluid. And then the patient who's NPO, he's going to be okay if he's NPO since midnight. So D would be the most at risk for fluid volume deficit. Nurse is assessing a client who's receiving TPN via an infusion pump. Which of the following actions should the nurse take?
B.
B, change the IV tubing every 24 hours. And we do that to prevent any type of infection and bacteria. TPN has sugar in there, bacteria can develop. We want to check the glucose more frequently. Patients that are on TPN, we are definitely checking glucose every 6 hours, even if they're not diabetic. Change the IV dressing, not every 4 days. Usually if you're getting TPN, you have a PICC line, then weigh the client every other day. They're going to be weighed every day because we are giving them fluid and electrolytes. Nurses teaching a client who has a prescription of an NG, that's an odd way of saying that, who has a prescription of an NG tube to treat a pyloric obstruction. Which of the following rationales for the use of the NG tube should the nurse include in the teaching? Why would we use the NG tube?
C.
Yeah, decompress the stomach. So the pylorus is going to be the opening from the stomach to the small intestine, and the NG tube goes down into the stomach. So if there is a blockage or an obstruction from the stomach to the small intestine, that air and stomach acid and everything's going to build up in the stomach. So we want to decompress that. Nurse is assessing a client who has a fracture of the femur. The nurse obtains vital signs on admission and again in 2 hours. Which of the following changes in assessment should indicate to the nurse that the client could be developing a serious complication?
A.
Yeah, that respiratory rate does not look good at all. We don't want anybody to have 44 respirations per minute, so be A. Nurse is caring for a client who's hospitalized with active pulmonary tuberculosis and is started on ethmidol therapy. The nurse should understand that which of the following should be monitored.
A.
Yeah, it's visual acuity. So this medication can cause optic neuritis, vision loss, loss of color discrimination. So they should have vision screenings. Nurse is assigned to care for a client diagnosed with autoimmune or idiopathic thrombocytic purpura. When reviewing the client's plan of care prior to caring for the client, the nurse should recognize that the priority concern in caring for the client is to monitor what? That was a long question.
D.
Yeah, so we're worried about with thrombocytic purpura that there is a decrease in clotting factor, so bleeding. Nurse is caring for a client who has an elevated potassium level and is on a cardiac monitor. The nurse is aware that hyperkalemia may be associated with changes to the T wave. This is asking what represents the T wave. So if there are changes to the T wave with hyperkalemia, what would we expect to see if we decrease the potassium level? If someone has an elevated potassium level, what do we see with the T wave?
The T wave is elevated.
Yeah, it's elevated. So I think another question on here I saw was, if we treat this and we decrease the potassium, what we would expect to see is a decreasing T wave compared to the previous EKG. So yeah, very good. A decrease in elevation, I think they said. Nurse is caring for a client who has myelosuppression after receiving chemotherapy. the nurse should monitor the client for which of the following adverse effects?
Is it C?
Actually, B. So anytime that we see myelosuppression, we're thinking about the bone marrow, and chemotherapy affects the bone marrow. It affects the production of red blood cells, white blood cells, and platelets. So I always look for something that indicates anemia or indicates infection or bleeding. So bleeding in the gums. Nurse is providing teaching to a client who has neutropenia. Which of the following information should the nurse include in the teaching?
B.
Yeah, B. So neutropenia is decreased neutrophils. That increases our risk for infection. So we want to avoid crowds. A nurse remains with the client to observe for any adverse reactions after initiating a transfusion of packed red blood cells. The client becomes apprehensive and tachycardic, reporting headache and low back pain. The nurse should recognize that these findings indicate which of the following transfusion reactions.
Is it D?
This one is actually B, it's hemolytic. So in addition to tachycardia, headache, and low back pain, a hemolytic reaction can also cause fever, chills, hypotension, chest pain. Um, we said blood in the urine. With a febrile reaction, we would see fever, but we wouldn't see headache or low back pain. If it was bacterial, we would see, again, fever, chills, but not the headache or low back pain. So those two things are really indicative of the hemolytic, the headache and back pain. Nurse is monitoring a client who's on telemetry. Which of the following findings on the EKG strip should the nurse recognize as a normal sinus rhythm?
A, the P wave falls before the QRS complex.
Yeah, P wave falls before the QRS. Our T wave should not be inverted. Our PR interval should be less than 0.12, and the QRS should be less than, no, that's not right. The PR interval should be 0.12 to 0.20, and the QRS should be less than 0.12. Yeah. Nurses caring for a group of clients in an infectious disease unit. The nurse should wear an OSHA-approved N95 respirator mask when caring for a client with which of the following infectious diseases?
C?
Yeah, TB. Nurse is caring for a client who has shingles with multiple skin lesions. Which of the following actions by the nurse require intervention by the nurse's supervisor? So which of the following is not correct?
A.
They've got B. So for A, with the N95 respirator mask, they have it's appropriate for the nurse to wear an N95 respirator mask because shingles requires airborne precautions. For B, they have when a private room is not available, clients who are infected with the same organism may be placed together in a double room. So they have A. I would say they're saying this because anybody who has not had chickenpox shouldn't be exposed, but anyone who has chickenpox is still susceptible to shingles.
Is
And
chickenpox airborne?
yes, it is. Nurse is teaching a client who has hepatitis A about preventing transmission of the virus. Which of the following strategies should the nurse include in the teaching?
C.
Yeah, they want to practice effective hand hygiene. Yeah, it's passed usually it's passed through the stool, but usually from not cleaning the hands very good. I want to kind of go back to this one for a minute. So the way that isolation precautions are determined, um, they most of the time what we do is we consult what the CDC says as far as transmission, but the CDC gives guidelines. It's truly up to the hospital to determine what type of isolation precautions that they use for their patients. And just also remember with isolation precautions, physicians don't order that. That's a nurse protocol. So we would follow our policies and procedures at the hospital. We don't need a physician's order.
Just random question.
Yeah.
When just going back to infectious and whatever, a patient that has C. diff, and I'm just asking not clinical based, but I'm just asking like testing wise for the NCLEX. Would you be allowed to place somebody who has C. diff with another person who has C. diff, like as in what the book or like what kind of education in that sense, just for future reference?
I would say no.
Okay.
Yeah. I would say no. Nurse in an emergency department is caring for a client who's bleeding profusely from a deep laceration on his left lower forearm. After observing standard precautions, which of the following actions should the nurse perform first?
B.
Yeah, we want to apply direct pressure. They're bleeding profusely, so we want to definitely apply pressure. I like how they let me put PPE on first, though. A nurse is caring for a client who has Meniere's disease and asks if he is allowed to ambulate independently. Which of the following responses should the nurse make?
C.
Yeah, we know with Meniere's disease, they've got the tinnitus, they're off balance. So anytime I think my patient's at risk of falls, I request that they call me first. So please ring for assistance when you wish to get out of bed. Nurse is teaching a client who has chronic kidney disease about limiting foods that are high in potassium. Which of the following foods should the nurse instruct the client to avoid?
Tomatoes and bananas, but I'm not sure about asparagus.
It's actually tomatoes, bananas, and raisins. So I kind of try to remember too that green leafy vegetables don't have a lot of potassium. So fruits do though. So tomatoes, bananas, raisins. Nurses providing dietary teaching to a client who has chronic kidney disease. The nurse should instruct the client to limit which of the following nutrients. Patients in renal failure.
D, phosphorus,
What else?
protein, and sodium.
Yes, protein, phosphorus, and sodium. Yes. Nurses providing, oh, let me back up. So protein and phosphorus, because they are hard on the kidneys. Sodium, because sodium, wherever salt goes, water follows. So if we're taking in a lot of sodium, we're going to hold on to a lot of water. Nurses providing teaching to a client about measures to prevent urinary tract infections. Which of the following statements indicate a need for further teaching?
A.
It's A. So needing to wipe, we should teach patients to wipe from front to back, not back to front. So they should empty their bladder regularly and completely. They should drink 8 cups of liquid each day. And on here it says that they should add 2 tablespoons of apple cider vinegar to their to juice 3 times per day. So I don't know if I would be advising people of that one, but we definitely want them to wipe from front to back. A nurse is providing teaching to a client about interventions to reduce the risk of developing cardiovascular disease. Which of the following statements by the client should indicate to the nurse the need for further teaching?
D.
Yeah.
C.
So it's D. Increasing the intake of foods containing trans fatty acids can lower risk. That can actually increase LDL cholesterol. And so it actually increases the risk. Omega-3 fatty acids are good. They're are good fatty acids. Nurses teaching a client about risk factors for osteoarthritis. Which of the following factors should the nurse include in the teaching? What increases our risk of osteoarthritis? We said that osteoarthritis was degenerative, a breaking down of the cartilage that's in the joints. So it causes the rubbing of the bones together and causes pain.
D, D, E.
What'd you say? I'm sorry.
C, D, and E.
C, D, and E. So aging, obesity, and smoking. Yes. Nurse is giving a presentation at a community center about chronic bronchitis. Which of the following information should the nurse include as effective for preventing this disorder? What do we want to teach patients?
Smoking cessation.
Yeah, smoking cessation. So when looking at this question, we think, well, ideal weight, we want people to have ideal weight. We want them to get vaccinations. We want them to exercise. But those things aren't going to prevent bronchitis. Smoking cessation could. Nurse is teaching a client how to do fecal occult blood testing. Which of the following statements by the client indicate a need for further teaching?
C.
Yeah, it's actually D. So it says that NSAIDs, not aspirin, interfere with fecal occult testing. Eating raw fruits and vegetables interferes with the testing. Eating red meat interferes with the testing, but the client should discontinue anticoagulants for 1 week prior to this testing. This statement requires clarification. So we would not want patients, let's see. Yeah, so I guess I was trying to read back on the question. So which of the following statements by the client indicates a need for further teaching? So I guess it's saying that patients should discontinue their anticoagulants for 1 week prior to testing. I would probably refer them to their cardiologist to ask about that one. But I think what it's referring to is which one is most likely to lead to bleeding in the stool. And so that would be the blood thinner. Yeah. Nurses caring for a postoperative client who had a chest tube connected to suction and a water-sealed drainage system. Which of the following indicates to the nurse that the chest tube is functioning properly? So what do we want to see?
A.
Yeah, we want to see fluctuations of the fluid level in the water-sealed chamber. Nurses caring for a client with a ventricular pacemaker who is on EKG monitoring. The nurse understands that the pacemaker is functioning properly when which of the following appears on the monitor strip?
C.
Yeah, pacemaker spikes before each QRS complex. A nurse in a long-term care facility is caring for an older adult client who had a stroke 4 weeks ago and is unable to move independently. The nurse should monitor for which of the following complications of immobility?
A reddened area over the sacrum.
Yeah, we're worried about skin breakdown, reddened area over the sacrum. Nurse is assessing a client who's in skeletal traction. The nurse should correct which of the following findings?
B.
Yeah, the weights rest against the foot of the bed. We want them to hang independently. Nurse is providing teaching for a client who has a new diagnosis of gastroesophageal reflux disease. The client asks about foods he should avoid eating. Which of the following foods should the nurse tell him to avoid?
Chocolate.
Yeah, chocolate. Should avoid chocolate. It causes pressure in the lower esophageal sphincter. Other things that should include fatty and fried foods, caffeine, alcohol, carbonated beverages. All the good stuff. Chocolate and the caffeine. The nurse is discharging a client from the hospital who has a new prescription for furosemide. Which of the following client statements indicate an understanding of this teaching?
Is it A?
No, it's not. It's probably the one that you say, okay, I'm going to limit this one. It's actually D. So what it says is furosemide or Lasix has a photosensitivity. So patients should are at higher risk of getting a sunburn. A, where it says eat a diet low in potassium, we would actually want them to have, they're at risk of low potassium. So either increasing potassium or at least a normal level of potassium. We don't want them to limit their fluid intake. We want them to drink, unless they're on a fluid restriction, we would want them to get adequate fluid because they're going to be losing fluid. And then blood pressure will increase. It actually will decrease. So it is limiting sun exposure and wearing sunscreen. A nurse in an urgent care center is caring for a client who is having an acute asthma exacerbation. Which of the following actions is the nurse's highest priority? So we think about if they're having an acute asthma exacerbation, what is going
Oxygen
to,
therapy.
well, what this one is getting
Well, the
to,
first thing we would do is high Fowlers and then nebulize.
C.
it's actually D. So what it's saying is if they're in urgent care, the priority action, it doesn't say what would the nurse do first. So that's one thing with the priority. We think about that. We think about, well, what order would we do it in? But priority many times means what is going to help them the most. So we think about with an asthma exacerbation, we want to stop that exacerbation. We want to open the airway. And the thing that would open the airway is going to be a short-acting beta adrenergic nebulizer. It would be D. Client's greatest risk is airway obstruction. Nurse is caring for a client who has a cardiopulmonary arrest. The nurse anticipates the emergency response team will administer which of the following medications if the client's restored rhythm is symptomatic bradycardia? What do we
Is it
get?
C?
Yes, atropine. Anytime you see bradycardia symptomatic, we're going to give atropine, and that's going to increase the heart rate. Nurse is preparing to administer a unit of red blood cells. The nurse responsibility is to compare and verify the information on the blood label with the client's information. The nurse should use which of the following as the primary source of verification? You go into a patient's room and you're administering any kind of medication. What are you going to use to identify that patient?
D.
Yeah, the wristband. And we're going to ask the patient, but that's not on there. Nurse is caring for a client who has type 1 diabetes. The nurse misread the client's morning blood glucose level as 210 instead of 120, and she administered the insulin dose appropriate for a reading over 200 before the client's breakfast. Which of the following actions is the nurse's priority?
B.
Yeah, we're going to monitor them for hypoglycemia. They're at risk right now. They're not hypoglycemic, they're at risk. Yes. The nurse is admitting a client who's having an exacerbation of asthma. When reviewing the provider's orders, the nurse recognizes that clarification is needed for which of the following medications?
A.
Yes, propanolol. So even if we don't know if it's a beta 1 or beta 2 blocker, if we see a beta blocker and we see asthma, what they're wanting is that we would question that, because if it's a beta 2, it could cause bronchoconstriction. Yeah. A nurse in a clinic is caring for a client who has prescription for digoxin. Which of the following statements indicate the client is experiencing a digoxin toxicity?
C.
Yeah, vision seems yellow. Blurred and yellow vision is an indication of digoxin toxicity. Nurse is caring for a female client who has rheumatoid arthritis and a new prescription for methotrexate. The client tells the nurse she's planning a pregnancy. Which of the following instructions should the nurse give the client?
B.
Yes, it's very tetragenic. It should be discontinued 3 months prior to planning a pregnancy. Nurse is admitting a client who has an acute heart failure following an MI. The nurse recognizes that which of the following prescriptions by the provider requires clarification?
D.
This one is actually C. Heart failure, we think about they have a risk of having fluid overload, and bumetanide is actually a diuretic. So it's a loop diuretic. But we would question continuous IV fluid if they already have a risk of being fluid overload. So C. Nurse in a clinic is caring for a client who has recently begun taking warfarin. The nurse is reviewing potential food and drug interaction risks and should instruct the client to avoid which of the following?
Is it B?
It's actually A. So with warfarin, we want to avoid vitamin K, and cabbage, along with those other green leafy vegetables, are high in vitamin K. Nurse is caring for a client who's post-operative following total hip arthroplasty. The nurse assists the client into a supine position. Which of the following actions is appropriate to prevent dislocation of the hip?
Place a wedge pillow.
Yeah, so A, place a wedge pillow between their legs. We wouldn't want to elevate the head of the bed to a Fowler's position. We'd probably want to keep the head of the bed elevated about 30 degrees, maybe even 45. But the higher that the patient is in that bed and it's not a sturdy surface, more likely that their hips could become out of position. The legs in alignment would be fine, but it's not going to prevent a hip dislocation. And the footboard would prevent a foot drop, but the wedge pillow between the legs would prevent that adduction, and that's what we're trying to prevent. Nurse is assessing a client who has systemic lupus erythematous. Which of the following findings is the highest priority for a nurse to report to the provider?
Is it B?
Presence of C.
It's actually C. The things what I think about with lupus, other than the butterfly rash, are that they have a great risk of cardiac and kidney failure. And so the presence of peripheral edema could indicate that either they may have a cardiac problem or they could have a renal problem. Yeah. Nurse is caring for a client who's unconscious following a cerebral hemorrhage. Which of the following nursing interventions is highest priority?
C.
This one's actually C. So if they're unconscious, think about kind of the things that we need to protect them from. And one of them is the airway and saliva. So this has got suctioning saliva from the client's mouth. So making sure that they don't aspirate. Nurses caring for a client who has quadriplegia from a spinal cord injury and reports having a severe headache. The nurse obtains a blood pressure reading of 210/108 and suspects the client is experiencing autonomic dysreflexia. Which of the following actions should the nurse take first?
Assess the client for bladder distension.
They've got C. Client who's experiencing autonomic dysreflexia is at risk for a cerebrovascular accident resulting from severe hypertension. According to the safety and risk reduction position priority setting framework, the nurse's initial action should be to place the client in a high Fowler position to assist in providing immediate reduction to blood pressure and intracranial pressure. So I guess from the blood pressure and the headache, decreasing intracranial pressure. Okay. Nurses caring for a client who came to the emergency department reporting chest pain. The provider suspects a myocardial infarction. While waiting for the troponin level report, the client asks what this blood test will show. What do we tell him?
C.
Yeah, so it's a heart muscle protein, appears in the bloodstream when there's damage to the heart. Definitely. On A, enzyme that indicates damage to the brain, heart, skeletal muscles, that can be myoglobin. Could be any of those muscles. B, reflects risk of coronary artery disease. That talking about a lipid is talking about cholesterol level. And a protein that helps transport oxygen is talking about hemoglobin. So yeah, C. Nurse admits to a client to the emergency department who reports nausea and vomiting that worsens when he lies down. Antacids don't help. The provider suspects pancreatitis. Which of the following laboratory tests should the nurse expect to see?
B.
Yeah, increased amylase, or it could be increased lipase if that was on there. Nurses reviewing the arterial blood gas results of a client who the provider suspects has metabolic acidosis. Which of the following results should the nurse expect to see?
A.
So if they're in acidosis, would the pH be low or high?
It would be low.
It'd be,
And 7.35 is in normal.
I'm sorry, I was looking at the wrong question. Yes, A, pH below 7.35. So if we look at the other ones, first we're always going to look at pH. Then we're going to move on to bicarb, CO2. We can look at the O2 levels. We want those to be above 70. So our pH low would indicate an acidosis. All right, good. Nurses caring for a client who has a serum potassium level of 5.5. The provider prescribes polyestyrene sulfonate. If this medication is effective, the nurse should expect which of the following changes on the client's ECG? So is that potassium level, is it low, normal, high? So we want potassium to be 3.5 to 5, so it's elevated. Polystyrene sulfonate is actually a medication that they drink, and it binds to the potassium and they excrete it in the stool. So if it's effective, what we hope it will do was be decreasing the potassium. And we said that if potassium is elevated, we may see an elevated T wave. So if we're reducing the potassium level, we should see a reduction in the T wave amplitude, the height of the T wave. Nurse is caring for a client who will have a blood sampling for a serum creatinine level and ask what this test shows. Which of the following should we tell the patient?
A.
Yeah, it's going to tell us how your kidneys are functioning. Nurse is caring for a client who has liver cirrhosis with ascites, bleeding esophageal varices, and portal hypertension. The nurse recognizes which of the following laboratory findings as indicating the client's gastrointestinal tract is digesting and absorbing blood.
Decreased bilirubin.
It's actually going to be elevated BUN. So patient GI tract, digesting, absorbing blood. So it's going to be waste products that are in the blood. And so this one is an elevated BUN. It says that the body digests blood, BUN rises. An elevated BUN is an indication of GI bleeding. Nurse is caring for a client who has acute kidney injury. Which of the following arterial blood gas values would the nurse expect the client to have? And I don't know if this is one we've had or just looks very similar to one we've had. So what did we say when the other one was chronic, but this one's acute. So acute kidney injury. So the kidneys aren't doing the job that they should be doing. They're having some acute failure. So we said, what part does the kidneys play in the acid-base balance? So the kidneys produce bicarbonate. And so if they can't do their job the way they should, we're going to have a low bicarbonate and resulting in a metabolic acidosis. So we would look first at pH for one that was low, below 7.35. So that could be C or D. And then we'd look for one with low bicarbonate. And we said bicarbonate's 22 to 26. So the one with low bicarbonate would be D. And so we would have a metabolic acidosis. And the PaCO2 is low, but that's in the opposite direction. So that would be a partial compensation. Okay. Nurse is evaluating a client who had a heart cath and is with a left antecubital insertion site. Which of the following pulses should the nurse palpate? So if we are using the left antecubital site, where are we going to check for pulses?
Radial and right.
We're actually going to check the radial on the left. So if we're doing a heart cath, and we can do a heart cath in the wrist, we can do in the antecubital site, and we've really started doing them a lot that way because there's a decreased risk of contamination, as well as it's easier to put a compression device on the antecubital side of the wrist versus the femoral artery. So we do those in the arm. So we're going in the left antecubital site. The area that's distal to that we want to check pulses would be the left radial. The nurse asks the client who is about to have a cardiac catheterization about any allergies. The client states, I always get a rash when I eat shellfish. Which of the following is the priority nursing action?
A.
Yeah, we want to notify the provider, right? Nurse is caring for a female client in the emergency department who reports shortness of breath and pain in the lung area. She states that she started taking birth control pills 3 weeks ago and that she smokes. Heart rate is 110, respiratory rate is 40, BP is 140/80. And then we've got our arterial blood gases. Which of the following is the priority nursing intervention? So if we look at pH, it's 7.5. So is that acidosis or alkalosis?
Alkalosis.
Alkalosis. Our CO2 is 29. So that's low. Would that be an acidosis or alkalosis?
Alkalosis.
Okay, so we've got a respiratory alkalosis, and our bicarb is 20. So we said bicarb 22 to 26. If that's low, that's actually in the acidic range. So that's our compensation. So we've got a respiratory alkalosis.
She needs oxygen because she's retaining CO2.
Yeah, so administer oxygen via a face mask. Very good. Nurse is monitoring a client following a thoracentesis. The nurse should identify which of the following manifestations as a complication and contact the provider immediately.
Increased heart rate.
Yeah, so why increased heart rate?
She could be having a bleed.
Yeah, so what I think about too, every time I think about a thoracentesis, I think they are going into the thoracic cavity. Complication could be that they punctured a lung. And so with that, we also think about that complication could be a mediastinal shift and problems with oxygenation, right? So increasing heart rate to try to get that oxygenation around. All right, good job. Nurse is preparing to administer 2 units of packed red blood cells to an older adult client. Which of the following actions should the nurse take?
A.
Yes, why A?
Risk for overload.
Right. Our biggest thing, especially if we're thinking about our patients, and they mentioned that we had an older adult, we're worried about fluid overload on our patients. So administering each unit over 3 hours. They say that we definitely want to have it in within 4 hours, but they say that the rule of thumb is 2 to 4 hours to administer. Packed red blood cells usually are between 350 to 400 milliliters. So administering it slower over 3 hours would be good, thinking about fluid overload. Nurse working on a medical unit is caring for a client who is prescribed seizure precautions. Which of the following intervention should the nurse include in the client's plan of care?
A.
Yes, we want to have an IV access. So whether it's that our patient may need Ativan or Valium, that we may need to give them medications if we have an airway occlusion, anything like that, we always want to have IV access. We don't need to keep the lights on. We want to keep the bed in a low position, and we never want to stick anything in their mouth like a tongue blade. Nurses caring for a client whose arterial blood gas results show a pH of 7.3 and a PO2 of 50. The nurse should identify the client is experiencing which acid-base imbalance. What do you think?
Respiratory acidosis.
Yes. And they didn't even give us the bicarbonate, so we couldn't even tell anything about a metabolic status. So yeah, respiratory acidosis. Nurses caring for a client who has peptic ulcer disease, the nurse should monitor the client for which of the following findings as an indication of gastrointestinal perforation.
Sudden abdominal pain.
Yeah, sudden abdominal pain. So other things could be a rigid abdomen, declining peristalsis, so decreasing bowel sounds, septicemia, hypovolemic shock, fluid loss, any of those things. Nurses caring for a client who has hypertension and a potassium level of 6.8. Which of the following actions should the nurse take?
B.
Yeah, so we know potassium's elevated. We're worried about cardiac complications. We're going to get a 12-lead EKG. Good. Nurses assessing a client who's post-operative and has anemia due to excess blood loss following surgery. Which of the following findings should the nurse expect?
A.
Yes, A. So anemia, fatigue, I would think also shortness of breath, pale skin, feeling cold. As far as vital signs, we would see a tachycardia and a hypotension, just like we would if a patient was dehydrated or any kind of blood loss. And then because we have blood loss, there's not as much blood going to feed the intestines. We would actually see maybe a constipation because that would slow down as well. Good. I've actually got 104 questions. I put them on there and I just didn't delete any. Nurses caring for a client 4 hours following a cardiac catheterization. Which of the following actions should the nurse take first?
A.
Yeah, so lying flat in bed. Says client should lie flat in bed. Clients who had manual or mechanical pressure after catheter removal require 6 hours of bed rest. And on this one, it says cardiac catheterization, so they didn't say, based on the answers, I would assume they're talking about a femoral entrance. So yeah, lying flat. Home health nurse is making a home visit to a client who takes a daily diuretic for heart failure. Which of the following manifestations should the nurse identify as indicating the client is hypokalemic?
A?
It's actually B. So they would have fatigue due to muscle weakness with the hypokalemia. If they were taking the diuretic, they wouldn't have edema. They wouldn't have retained fluid. So yeah, they've got fatigue. It says nurse should expect dyspnea with hypernatremia, but hypokalemia would result in fatigue and muscle weakness. Nurse is preparing to administer an osmotic diuretic IV to a client with increased intracranial pressure. Which of the following should the nurse identify as the purpose of this medication? Where are we giving it to this patient?
A.
Yeah, we want to reduce edema of the brain, intracranial pressure. Nurse is assessing a client for hypoxemia during an asthma attack. Which of the following manifestations should the nurse expect? Hypoxemia being low oxygen in the blood.
Agitation.
Agitation, yes. Very good. All right. That's all I got. I've got a question for you. I got a bonus question. So I was thinking about this. What if you had a question that said, the nurse enters the patient's room, the patient is shivering, and he says, I'm so cold. What would the nurse do next?
Check his temperature.
Yes, definitely. So another assessment. This is a true story. So when I worked a few years ago at the VA, I had another nurse who, many times it's the tech that goes in, and but the tech had told her the patient was cold, and she said, put some more blankets on him, put some more blankets on him. And they did that, and he was shivering and cold because his temperature was elevating. He actually had pancreatitis, and he wound up having seizures, and his temperature was 106 and went to the ICU. So our instinct many times is to act, but always see if there's another assessment. And that's the same thing that's true with NCLEX questions or anything like that. Do I have enough information to definitively know what it is, or do I have more questions? All right. Anybody have any questions about anything? I saw your ATI scores. They were phenomenal, and I was so excited, but I wasn't surprised.
If we have any questions over the weekend, because I know I'm going to go back and rewatch this, are you going to have your email open?
Oh, yes, always. Yeah, send me an email. Anything else? All right, guys. Well, I will let you go then. Again, if you think of anything, contact me. And best of luck on your exam on Monday.
Thank you so much for your time again.
You're very welcome. I enjoy it. Bye-bye.